Well, thank you very much, Molly, and good afternoon and welcome everyone today to today's integrative nursing webinar hosted by the Early Bakken Center for Spirituality and Healing. As Molly said, I'm the director of the center. I also am the lead of the Doctorate of Nursing Practice specialty in integrative health and healing in the university's School of Nursing. Throughout the center's history, we have worked in support of health professionals, including integrative nurses. And we are very excited to be hosting as our speaker today, Dr. Erica Timko-Olson, who will share a presentation titled Unlocking the Interconnectedness of Nature and Nursing, the Illusion of Separateness. Integrative nursing is a way of being, doing, and knowing that advances the health and well-being of persons, families, and communities through caring and healing relationships. Integrative nurses use evidence to inform traditional and emerging interventions that support whole person and whole systems healing. Integrative nursing principle number 3 states that nature has healing and restorative properties that contribute to health and well-being. As integrative nurses, we know that there's a strong relationship between access to nature and outcomes of health and healing. We also understand from research based on biophilia that being in nature or having access to nature produces positive health outcomes. Dr. Timko-Olson will share more today about the interconnectedness between nature and nursing. Now, I'll tell you a little bit about Dr. Erica Timko-Olson and her background. She's a clinical assistant professor in the University of Minnesota School of Nursing. Her educational background has focused on the support of integrative health, healing, and spirituality modalities to promote well-being. Her master's degree program included formal coursework on integrative healing therapies and spirituality, and she was an integrative nursing faculty fellow at the University of Arizona in 2018. Throughout the past 20 years, Dr. Erica Timko-Olson has taught across all levels of nursing education, from associate degree to PhD programs. Through her interactions with thousands of young adults, she has observed firsthand the benefits of strong relationships, integrative interventions, and psychological support for this young adult age group. She's been conducting research using nature-based interventions to support physical, psychological, and spiritual well-being. And you'll have the pleasure today of hearing about some of her ongoing research. Welcome, Erica.
Thank you so much, Mary Jo, and it's a complete pleasure and joy to be here. When Mary Jo first asked me to do this talk, it was, oh, sure, it's way at the end of summer, and here we are at the end of summer already. I'm not quite willing to give it up, but thank you for that very kind introduction. I'm going to go ahead and share my screen here, and this is a topic that I'm very passionate about. And I'd like to welcome you to just sit back and relax, however you see fit, and participate however you would like to. I want to give a quick disclaimer. I try to live my life in authentic relationship with all the roles that I fill. So I'm an avid volunteer in my community. I'm a researcher, a teacher, professor. I am family supported, and my greatest role is a mom of 6 crazy, wonderful, nature-loving kids. So my life is my life with very few boundaries. So today I will share personal stories as well as dig deep into the research in this area and also my future research interests. So if any of these topics are something you would like to learn more about or partner with me in any way, or just maybe just brainstorm about some fun opportunities that you would like to participate in, I would love to hear from you. And so without further ado, I'm going to hop right in and talk about unlocking the interconnectedness of nature and nursing, the illusion of separateness. So as we begin, I want to give credit to a wonderful, kind, and loving mentor, my dad. He was and is a farmer, a lover of the land, eternal supporter, and really the reason I'm here in this place today with you. I've had many aha moments in my life, but a true turning point for me and getting into unlocking this interconnectedness of nature and nursing came at a time in my life just a few years ago. I was living in Philadelphia, teaching at UPenn, and struggling with my wellness and the wellness of my family. I had just had our sixth baby and moved across the country from Minnesota. I'm sure that you can imagine the shock to my system. I was talking with my dad on the phone, and he listened as he always does, and then said something I'll never forget. He said, "Erica, when is the last time you saw the horizon?" I had no answer. I had no answer. I had lost my connection to my place on the earth. I had lost the sunrise and the sunset. I had lost the promise of a new day. The good news is that nature is there, waiting for us to reconnect, to welcome us back into relationship and demonstrate the importance of our interconnectedness and the illusion of separateness that has prevailed in the last century. I also want to acknowledge that many people are disconnected from nature due to the trauma experienced in past generations. Our brothers and sisters who came to this land as slaves have experienced significant trauma, and many have fear while in nature. Just as the tree rings can tell of past traumatic growing seasons, our stories of pain are also present today. Our native people who were forced from their lands, separated from their language and traditions, have also experienced this significant trauma. It is important to be mindful of these experiences as we think about nature therapies. So my story is unique to me, but I'm sure that we all have pivotal moments in our lives. I invite you to open your mind and your heart today and be open to how your story may unfold and how nature fits into your story. Today, I want us together to examine the healing and restorative properties of nature, understand our essential role as nurses in healing and restoration of wellness for us, for those around us, for our community and our world, and link the long-term benefits of reconnecting these relationships between nature and nursing. But first, let's take a journey back to the beginning in nursing, and also with the native lands in which we currently reside. I'd like to have you think for a moment about where you are from. What does this mean for you? What stories does that come up in your mind when I say, where are you from? What were your surroundings like growing up? And what are they like now? Where do you spend your time? My children are the first generation on my side of the family that will not grow up on a farm. And how will that impact them? And different from how I grew up. How many minutes per week do you spend in nature? How many minutes per week do you spend in nature? Go ahead and jot that down on a piece of paper or your hand or on your computer, your phone. How many minutes today that you could estimate you spend in nature? You may have heard that 120 minutes outdoors is now the new 10,000 steps. Why is that? Well, research in London found that spending at least 120 minutes per week in nature leads to good health and well-being. They found that the benefits of nature peaked at between 200 and 300 minutes a week, so 3 to 5 hours per week. So to maximize our time, according to these researchers. 3 to 5 hours would be amazing. I had an opportunity to speak with one of the researchers, and I said, so why do you think it peaked at 5 hours? And he didn't know, but he said, well, the weather in London is absolutely horrible. So I think it was the dog walkers that felt forced to spend that extra time outside with their dogs. So they were just irritated if they were out for more than 5 hours. I thought that was really funny. I'm a dog walker. My dog walks several miles a day, three times a day, a few miles, a mile or two each time. So I don't think that there's ever too much time walking a dog, but apparently the atrocious weather in London may have affected their study. So now that you have kind of a baseline of where you spend in nature, how much time you spend in nature, I want to take you back to Florence. Florence Nightingale has some simple yet profound words that we can examine. She tells us that nature alone cures, and that what nursing is to do is put the patient in the best condition for nature to act upon him. Now, I'm sure you've heard that what we must do is put patients in the best condition to heal themselves. But we are nature, inseparable from her. So these words are not contradictory. And from her, we know that nursing was meant to assist nature with the healing of the patient. And here we are 100 and some years later, and Florence Nightingale's words are still holding true. We're returning back to our roots. Another key aspect of this is our own recognition of the land in which we inhabit. This is a picture of the waterway border of Canada and the US around Grand Portage, Minnesota. It is home to the Grand Portage Band of Lake Superior, Chippewa, commonly known as the Grand Portage Ojibwe. I'd just like to acknowledge that. And also, the next piece I'm going to read for you is from Robin Wall Kimmerer in Braiding Sweetgrass. And she tells us that we can follow the teaching of white man's footsteps to strive to become naturalized to place, to throw off the mindset of the immigrant. Being naturalized to place means to live as if this is the land that feeds you, as if these are the streams from which you drink, that build your body and fill your spirit. To become naturalized is to know that your ancestors lie in this ground. Here you will give your gifts and meet your responsibilities. To become naturalized is to live as if your children's future matters. To take care of the land as if our lives and the lives of our relatives depend on it, because they do. This is the model that demonstrates the concept of nature therapy. We are often in this day and age in a stressed state, but then we can experience nature in a variety of ways that causes that physiological relaxation, and our immune system begins to recover. We can actually use nature therapies as a preventative tool, not just a treatment tool, but a preventative tool to face a lot of the challenges that our bodies physically, spiritually, and psychologically are facing today. Nature therapy, if you're wondering, is defined as a set of practices aimed at achieving preventative medical effects through exposure to nature stimuli that render a state of physiological relaxation and boost the weakened immune system to prevent disease. Now, what are some of these therapies? I'll go a little bit more in depth into forest bathing as we walk through this, but there are many different types of nature therapies. One that I'm sure you've heard of is adventure therapies. This is the people that like to go rock climbing and rafting, and they explore nature individually or in group settings. And then there are animal-assisted interventions. I'm sure you've heard of animal therapy, which really builds relationships between animals and humans. But animal-assisted interventions can happen when people go to a farm and they pet the animals or feed the animals. We have a local llama farm here where people go and do yoga with llamas. And I think they do yoga with goats too. Growing up on a farm, I know what happens in the pasture. So personally, I'm not drawn to that, but a lot of people are. There's also arts and crafts, like the name suggests, that combines creative arts and crafts with nature. So you can be outside painting in a green space, or like my kids love to make things. I have a daughter who's a potter, and when she has her hands in the clay, it's so therapeutic for her. People who work with wood or they use green spaces as inspiration for art are really in this beautiful photograph. People finding pieces of art that are really beneficial for their healing. Also conservation efforts that people participate in. Dark nature, as you can see from my background, might be something that you're interested in, where activities take place at night. So stargazing, for example. I've been out with my family where we've done nighttime cross-country skiing with illuminated trails, a phenomenal experience. Green exercises, where you do physical activity out in green spaces. So it can be running, going for a walk. And then there's therapeutic farming and therapeutic horticulture, where you're caring for animals and the land and growing crops. And then, of course, wilderness therapy, which I'm sure some of us have maybe even participate in, where you have time outside doing adventures. I have someone that I know that has a dog sled team, and he takes people out into the wilderness with his dog sled. So that could be a combination of maybe a little animal intervention and wilderness therapy together. So there's multiple modalities when we start talking about nature therapy. One that I want to talk to you a little bit more about and experience a little today is forest bathing. And it is one nature-based intervention. It is from a Japanese practice that uses all 5 senses to fully immerse ourselves in nature. And this happens to be my daughter while we were on a trip this summer to Grand Portage State Park in northern Minnesota. So I love this picture, and I'll talk a little bit more about this, but you can notice when we get to the end of my presentation, notice these trees. There's the birch trees in this picture, but there's also the fir trees. So we'll talk a little bit how those trees really live in harmony with one another. The sad part of this picture to me is these waters are contaminated. So we couldn't walk through the water. It was illegal for us to go to Canada anyway, because the border is closed. But we couldn't actually put our feet in the water or swim in the water. It's unsafe for drinking as well. So again, protection of our waterways is very important. So right now, I just invite you to sit or stand comfortably wherever you happen to be, and close the door. If you have an office where there's some distractions, and put in your AirPods if that will help you. Whatever you need to do to be fully present right now. So if you can have your feet on the floor or on a stool if you're really short like I am, so you can just relax for a moment. And if you would like to take just a few deep cleansing breaths in through your nose and out through your mouth. Let's just do this 3 times together. And as I was traveling in northern Minnesota this summer, I was thinking of our time together today. And as I came around the bend, I saw this beautiful landscape. And I was thinking of how we could journey together in the forest today. And how could I best tell my story to you? And I think this picture is a great example of it. So as you're here together, taking nice deep breaths, always returning to our breath, and our lungs look just like the roots of a tree system. The connectedness that we have with our surroundings is really important. As you take some deep breaths, can you imagine the smell of the forest floor? It's early morning and the humidity is pretty high in this valley. And there's a dampness, an earthy smell, an earthy tone, a very full smell to the forest floor. The mosses, the ferns, the rotting wood. Can you feel the cool breeze of the morning on your skin while anticipating that warm sun that is just coming through and reaching that small clearing right in front of you? How will that sun feel? Do you want to lean into it a little bit? Or do you want to stay in the cool forest floor? And while we're on the floor of the forest, notice the movement of the leaves, maybe a chipmunk, a newly emerged butterfly. Can you hear the butterfly wings rustling, or the leaves as the wind moves across the forest floor? And maybe you can hear the creak of the branches as the wind moves up the trees. And finally, the wind escapes through the leaves on the top of the canopy of the forest. Can you taste the dampness of the forest, of the morning dew, of fullness of the earth? Now let's return to our breath. Thank you for journeying in the forest with me today. We know that nature can heal. And nature can also evoke some amazing emotional responses. Nature provokes feelings of awe and inspiring energy that's been shown to reduce stress-related symptoms and increase overall human well-being. As little as 10 minutes of quiet stillness can lower cortisol levels, or even viewing photographs or videos of nature scenes can have restorative effects with few negative feelings and an increase in positive mood. I was teaching research to master's students. It was a pretty stressful time, if you can imagine, this last spring. They're in graduate school, they're in an accelerated program. It was the height of COVID. We hadn't yet gotten the vaccines out. We were hoping they were coming. They were going to clinical, afraid every day of getting COVID and bringing it home to their families, or worse yet, bringing COVID to a patient. And now we were online and they were in a research class. Not necessarily the best placement in the program right away, their second semester, but it's a pretty fast-paced program. So I had the students participate in a forest bathing experience, much like what we did today, but for 20 minutes once a week during class, not outside of class, during class. And that's how important their wellness is, that I'm doing this in class. They reported a statistically significant reduction in perceived stress, and 63% of the students reported that the activity reinforced their beliefs, reminded them of the importance of well-being, or they developed a new awareness of the importance of personal well-being. Imagine taking 20 minutes once a week to care for ourselves, or for those of you who are researchers, to show our care and model our care for our students and for teachers to be aware of the importance of this. It was really profound, because I kind of go out on a limb and never quite know how it's going to be perceived. Also, individuals who scored higher on measures, of connection to nature, are more likely to score high on measures of psychological resilience, another passion of mine, of building resilience. And we know that resilience can help support mental health, mental well-being, and supports the basic tenets of eco-psychology, the basic tenets of eco-psychology, in that this emphasizes a link between mental wellness and the connection with the natural world. And we know this in research as it supports all these ideas that we have. When we're talking about our neuroendocrine system, this area has had extensive research and publications that support the well-being connection with nature. Walks can reduce pulse rate, affect our cholesterol levels, decrease our risk for type 2 diabetes, decrease risk for preterm birth, decrease risk for small size of gestational age children in pregnancy. And we know scores for anxiety, confusion, depression, and fatigue, and overall good health are affected. Also seen is an increase in protein that decrease cardiovascular inflammation. Heart disease, the #1 killer of our people in this country. Research is also being conducted in this area to further develop the back to nature theory. Since humans evolved in nature, it's where humans feel most comfortable and achieve homeostasis within nature. And it just makes sense that we are nature. 99.9% of human existence has been spent in nature. It's 0.01% of our lives that has been urbanized now, and our bodies are feeling the effects of this. And as you experience, viewing forest landscapes also can show some physiological relaxation in our prefrontal lobe. We have seen that forest bathing can support and improve mental health and well-being as well. And we have seen physiological relaxation and immune system recovery. Our natural killer cells are increased as we spend time in nature. The forest participates in preventative care when we are exposed to flowers, plants, and the forest. So the next time that you are in the supermarket and you want to pass up those $10 or $15 arrangements of flowers and you think that it's a waste of money, I always think that it's less than a copay to my therapist. So I always buy the flowers, and my husband buys a lot of flowers too, so it's great. And I cut them and bring them in from the garden as well. Research is being conducted using pictures and videos of nature, like I have been doing in my courses, as well as interactions with houseplants and indoor foliage. Some have looked at an hour or two in nature, and even some have looked at just studying an hour or two in nature and up to several days or weeks. So when we talk about these adventure trips where people might be gone for 10 days or so, a lot of the work coming out of Japan too focuses on a weekend retreat or a weekend away. There's a lot of great work also coming out of South Korea, which is a country about the size of Minnesota, but they have, I believe it is 5 retreat centers that specifically just focus on interactions with nature around the country that people are able to participate in. So there's some great work going on in that area of the world. To understand the essential role of nurses in healing and restoration of wellness, we must know that nature and nursing are fundamentally interconnected. The metaparadigm of nursing can be broken down into 4 main activities I think that are most important. First of all, as nurses, we pay attention. We listen intently. St. Benedict talks about listening with the ear of our heart. And that's just such a great visual for me to think about. It's not listening with your ears, with your head, but listening with the ear of your heart. To be aware and to breathe, which we participated in today. These activities not only sustain the well-being of humanity and nature, but support them to flourish. Pay attention, listen, be aware, and breathe. These activities challenge us to dig deep to find meaning and purpose in our experiences as nurses. And boy, have we had a lot of experiences that have challenged our wellness in the last year or two. Mary Jo mentioned briefly the foundation of integrative nursing. I just want to talk about these principles just briefly on how they relate specifically to nature. We know that they relate to nursing, but what is that connection? Human beings are whole systems, inseparable from their environment. Nature and humanity are inseparable because we are nature. And as nature is unwell, we are unwell. And as nature is well, we are well. So we have that reciprocity that's very important. Human beings have an innate capacity for health and well-being through nature. And then, of course, nature has healing and restorative properties. We just put that one right out there. I love that. That contribute to health and well-being. The health and well-being of the planet, of nursing, of people, of families, and communities. Integrative nursing is person-centered and relationship-based. Everything is about relationships. Relationship with self, relationship with others, relationship with our environment, relationship with the greater spiritual world. Everything is relationship-based, and nature is a key component of that. Integrative nursing is informed by evidence and uses a full range of therapeutic modalities to support the healing process, moving from least invasive to more, depending on the need. Nature is one of our least invasive modalities that we can use. Even just spending time with our plants. Today, while I was preparing for this, I have 4 plants that have sat with me all through COVID. One's not doing so great, 3 are flourishing. I was like, oh my gosh, they need to be watered, right? Sustaining those systems around us. So even just house plants and watering, I found my stress level go down just a little bit. And integrative nursing focuses on the health and well-being of caregivers as well as those they serve. And that's exactly it. That's a passion of mine, is looking at the health and well-being of our nursing students and setting them up on a path to wellness. And nature is an important piece of that on how they can care for themselves while they're responsible for caring for others around them in their communities and the planet as a whole. Pretty big task. I'm so honored to be a part of the University of Minnesota School of Nursing's vision that states that the University of Minnesota School of Nursing vision is for optimal health and well-being for all people and the planet. We're bold, we're putting it right out there that we care about our planet. Interconnectedness with nature and the balance between respite and healing supports our physical, psychological, emotional, and spiritual well-being of humanity and the earth. We see this through research in emotional, neuroendocrine, neurobiological responses to nature intervention. As these effects benefit our patients, it must also apply to nurses as healers. We are inseparable from our parts. Nature is our first guide and healer. By working together for a common purpose of healing self, others, and the earth, we will see the best outcome for all. The long-term repercussions of not connecting to nature and nursing are very clear. We know that as our planet of our health has declined, the health of our planet has declined, we've experienced population displacement, new disease patterns, and health needs that we're all living with every day. Stresses on our air quality, again, food production and water systems. We've also experienced significant equity concerns, as well as being aware of the generation of sustainable energy. They're all intimately related to health, the health of our planet, and the health of our humanity. Nurses are key to achieving the sustainable development goals that we see with planetary health, and we'll talk a little bit about that. It is critical that nurses and other healthcare providers understand and consider the multiple effects on our ecosystem and on human health. We need to develop systems that support the health and well-being of individuals all the way to the health of our planet. How can we do this? The Planetary Health Alliance has developed a framework for education. So I want you to view this diagram on the right as if you were looking at the end of a freshly cut cord or a rope. Or if you're a candy fan like I am, think about Twizzlers Pull and Peel and how there is all those little tiny strings that you can pull off and eat. In the middle of that is our interconnection with nature. When this model came out, I was like doing a little happy dance, if you can imagine. So you'll notice at the center is the connection with nature. The best way to build our interconnection with nature is to spend time in nature and allow her healing to take place in our mind, our body, and our spirit. Research tells us that what we already know, that time spent in nature produces greater responsibility to care for her and the responsibility to support her healing. And as nature heals, we heal. And as we heal, nature heals, because we are nature, inseparable from our parts as one whole and complete being. So the Intergovernmental Panel on Climate Change issued a report this week. I encourage you to take time to understand the implications of climate change. I'm not going to go into that report, but there are some stark realizations that it does point out. There's some great resources online as well. So this is the Planetary Health Alliance model framework for education on how we can better understand what we need to do to support the health of our planet. And then I want to hop into a couple of things that are really exciting to me. Look at this. This is a picture of Nature, the cover of Nature magazine, a preeminent journal that is published. And this is from August 7th of 1997 on the cover of Nature, the Wood Wide Web. I think that's pretty cool. So we can look to the Wood Wide Web to support the long-term benefits of this connection. Nature already has this built. We don't have to reinvent the wheel. She's an amazing teacher on how nurses can reconnect and flourish in nature. We know that trees have an amazing relationship of shared nutrients with their root system and with the floor fungi. They support one another, communicate with one another, and share nutrients with one another. There's a beautiful story that Robin Wall Kimmerer tells again in Braiding Sweetgrass. I've modified it a bit for nursing, but she says reciprocity with nature is the key to success. When nature is cared for, when our patients are cared for, when we are cared for and treated with respect, we will flourish. But if the relationship fails, so does nature, and so does nursing. What we are talking about is more than ecological restoration. It's the restoration between nature and nursing. Nurse researchers have made a dent in understanding how our body systems work and how we can put them back together, treat our symptoms. But all of that is matter, at the exclusion of spirit. We might look to our ancestors, the trees, for guidance on weaving matter and spirit back together. We are dreaming of a time when the land and when nature might give us our thanks back to nursing and back to the people. This is a model that researcher, I love her. Her name is Suzanne Samard. She's out of British Columbia. This is a mapping of a forest in British Columbia. And to me, it looked a little bit like the COVID mapping that we've been doing in our county. But you'll notice that this is a positive mapping on relationships of the trees. And the larger the circle, those dark green circles, the more importance that tree has to the forest. And we call those the mother trees. So research found that the biggest and the oldest trees were the most connected in the forest. They've been called the mother trees, and they share their excess carbon and nitrogen, so their sugar, through this network with the seedlings around them. And they share extra, have a little preference for the seedlings that are just like them, but of course they take care of the neighboring seedlings as well. It's very interesting that the like kin seedlings do take a little more carbon from the mother trees rather than the stranger seedlings do. But what we can know through forestation is if we remove some of these smaller trees and leave the mother trees, that the seedlings then that are placed and replanted or just naturally planted will flourish even more. So when we destroy the entire forest and just plant these seedlings, they have no chance for survival. But if we can thin and care for the forest and allow those seedlings to grow up and keep the mother trees, we have a healthier forest. And that is a healthier planet. And I also really love the relationship that trees can have with one another. They're really complex. Remember that first picture I said to notice the fir trees and the birch trees? Trees can form complex relationship with other species, similar to partnerships or friendships that we experience. A birch tree competes with young neighboring Douglas fir trees for light, and they can reduce the growth of those trees. However, in contrast, the birch actually help those Douglas fir trees by sharing their carbon and sharing their food. So the more birch tree shades the Douglas fir, the more carbon it delivers. So the healthier I am, the more I can share that with those around me. The trees also trade resources seasonally. So the Douglas fir tree shares their excess sugar when the birches don't have their leaves in the spring and the fall, when they need extra nutrients. And in return, the birch provides the fir tree with sugars in the summer. So they have this great reciprocity of caring for one another. Other experiments have shown that connections between these trees and species like aspen and birch are really important for mitigating disease and insect outbreaks. So by protecting these Douglas fir trees, rather than removing them and cutting them down and spraying them with herbicides to make forests more resilient, they're naturally more resilient because the birch trees have a lot of water in their leaves that protect the forest from fire. They also contain less resin and they're less flammable. So there's this great relationship that they have. They also help maintain the biodiversity of animals, plants, fungi, and other organisms. But if you take out the birch trees, they also see that there is an increase in disease. There's a disease, I can't remember what it is, but it attacks the roots of the Douglas fir trees. And the birch trees have natural chemicals in them that help mitigate that disease. So they work really well in harmony with one another, like nature and nursing, working in harmony with each other. A couple final thoughts here. My current research involves a couple different areas that I'm working in. I just completed a study with some nursing students during COVID. They went on 5 one-hour audio guided nature walks in a beautiful preserve on their campus. And I created an audio file with a forest guide to be used for all the walks. And the preliminary analysis looks pretty positive for increase in their overall well-being, even while during COVID, and nursing students, as you can imagine. And I also just submitted an IRB proposal for a pilot study that's really comparing 1-hour walks that people just go out with no prompt, and then when they go out with just some basic written prompts, and then they'll go out with an audio guided prompt. Again, these are all by themselves, and then going out with a group of people and having a guided walk experience. So that is to results coming forth once that gets through IRB. And we're also going to have focus groups at the end of that to see what their experiences were. And then my future, what I'm interested in, you don't have this slide on the slide deck that you have, because these are my crazy kids. But my future work will involve a pilot intervention looking at nature-based interventions with young adults experiencing or surviving cancer. So that's an area, my clinical background is in oncology and hospice. So I have a strong affinity for pulling these two together. I'm also really interested in looking at blue spaces and potentially flowing water and what that looks like. There's some work going on in Europe right now, and I find it pretty interesting. I haven't seen a lot quite yet on it, but what makes these kids scale steep cliffs, even my 5-year-old who's afraid of so many things, just to get into this flowing water. And I know that there was a lot of healing going on this day that we all experienced. It's been a rough year for all of us. And to go up and to see this waterfall, and instantly everyone just started climbing and getting down there and into the water. It was one of the most joyous times that we've had this year. So I hope that you learned a bit about the benefits of spending time in nature, and will commit to at least 2 hours outdoors in the coming weeks and months. You may also be wondering what else you can do to support nature and care of the earth to improve wellness. And I have a couple ideas, of course. One is education. So I suggest starting by reading a few articles on the health implications of climate change. This was a Journal of Nursing scholarship that has a lot of great articles. So that would be a good place to start. I also have a reference list at the end of this presentation that is also, the reading that I do. One of my must reads right now is Finding the Mother Tree. If you Google Suzanne Simard, she has TED Talks, she has YouTube video interviews, and I just bought her book that just came out. So I highly suggest that. And then a book that never leaves my side, it's always with me wherever I go. My daughter is like, "Are you going to finish reading that?" And I said, "I'm never going to finish reading it. I just keep reading it." So I bought her own copy. Braiding Sweetgrass by Robin Wall Kimmerer, and I shared a couple stories from that today. And I've also heard that the audio file is amazing because she narrates it herself. So I would encourage that as well. And I'll leave you with one final thought: to slow down, be present, be mindful, and rest in the woods, and allow the healing power of nature to perform her work from within.
Well, thank you so much, Erica, for that beautiful, beautiful presentation, and what a lovely quote to end on. So there's several questions that have come in, and I'm going to just start out right away by posing some of them. One person wrote, Erica, that a nature prescription can seem like it's coming from a privileged perspective when people are struggling with food and shelter and physical safety. Any ideas on how to be sensitive to this in populations dealing with these realities and still encourage them to connect with nature in some way?
Yeah, that's an interesting question. Actually, I was just discussing this last night. There's a gentleman in our community that has given everything up, sold his home, and he is starting he started a food rescue. Pretty much, he rescues 90% of the food that the food shelves get rid of every week, and he delivers healthy foods to people. But then he found that there was a housing issue, so he bought an old group home and is transforming it in so families can live there in transition. So these are families that are having a very difficult time with housing insecurity, a lot of mental health issues, transitioning out of drug and alcohol rehab centers. But behind it is a beautiful nature preserve. And so we talked last night about how the presence of that gently, slowly, could maybe be something that could be beneficial in conjunction with all the other needs. So it's not something that acts in isolation. If someone comes in is really struggling, the first answer is not, well, you just need to go spend an hour in the woods, right? But how can we slowly, naturally encourage the movement towards green spaces that we know can support their wellness? It's a tough question.
Yeah, Erica, really, I think a good reflection, and I think as I think about that question, it's not an either or. It's a both and, just like the conversation you had with the gentleman, reflected. I think one thing that's really interesting about nature interventions is they can cost nothing. And there's so much, I think, that we sometimes recommend around lifestyle interventions where sometimes even healthy eating is a challenge because people are in food deserts, and sometimes healthy food is more expensive. And I think, as nurses, one of the things that we can really think about are what are simple interventions. And, if people don't have access to a nature preserve beside where they live, or, if they're in an urban area and there's not a lot of parks, what are very simple ways that people can create a connection with nature? Interesting studies that have been done, like in senior living, long-term care, that even giving a senior a plant in their room that they're responsible for can positively impact, their health and well-being. Having views of nature, ideally a natural view, but even if it's a picture on the wall, that can have a positive impact. So I think, as nurses, we can really think about what are ways that we can make this, really accessible.
Yeah, and not forget that the built environment is important. And we know in hospital spaces, having views of nature increases healing time, gets people discharged more quickly. And the views of nature can be on a screen, can be on the wall, can be actually outside. So, and also the sunlight and the importance of natural light can be beneficial too. So I think thinking small and simple can have profound impact, especially if there is reluctancy and fear.
Mm-hmm. There was a book that I read many years ago, I'm sure it was over a decade ago, and it was titled Sanctuary Gardens. And the concept of it was how you could create a sanctuary garden in a little teeny corner of your house, or on a balcony. And it was just sort of the concept of creating, a special healing space. Somebody else wrote in the chat, I frequently ask my patients who are homebound to sit by their windows in the morning and evening and try to focus on sounds of nature, such as wind and birds, etc. Thank you, Judy, for that really simple recommendation. Somebody else wrote, Erica, that they too have read Braiding Sweetgrass. They can't believe they hadn't heard of the book before. It's the most amazing book. And the question is, how would you recommend integrating this book into a nursing program, either at the BSN or MSN level?
Wow, that's really interesting. I am by nature a storyteller, so I think when talking about teamwork, talking about leadership, that might be a good time to talk about the story of the three sisters. And maybe talking about purpose and meaning, that might be a good time. If you're doing a spiritual assessment, talk about assessments. That might be a good time to weave in the Thanksgiving story. So I think it is pieces of it. I don't think it would be something, just like I can't sit down, I'm in my mid-40s, and to sit down and read it, it's something that you have to experience rather than just reading it or listening to it, for me personally. So I would incorporate story into the different aspects of what you're teaching and how these stories can really strengthen that relationship with nature. Also, when we're talking about building resilience and perseverance and changing nurses over time, the idea of where you think you are now and where you're going to be. I love the story of how she cleans her pond and how it's never quite where she wants it to be and constantly working on it, but she can still enjoy the process. There's times where her kids can still go into the pond, but they at least sit on the edge of the pond and experience that. So sometimes we're not in the height of what we want to be doing, but we're developing resilience and perseverance. And wow, isn't that nursing, right? Of how we can do that. So I would love to see weaving of these stories into the curriculum.
So another question, Erica, how do you recommend that nurses encourage patients to reconnect with nature? How do you best bring that up in a busy clinical environment?
I would start with kind of how we started today. So, it's important to know how people spend their day. And would you be interested in spending some more time in nature and the healing effects? Do you have any experience with that? Tell me what that looks like. Kind of a little nature assessment that you can do as you weave in understanding people's stories. And I haven't, I teach an assessment course and holistic assessment from sleep and spiritual and nutritional and things, but that would be another fun thing for me to develop a nature assessment to see what that looks like and how we could start. But I think we start from a place of understanding of where they are today and just slowly share on how beneficial weaving small pieces of nature could be.
Yeah, one of the things that I also think has been really helpful is that a lot of hospitals, under the whole evidence-based design, the built environment, are looking at ways to bring in nature. And sometimes it's as simple as one of our attendees just wrote, sunshine therapy for inpatients, like opening the blinds, opening the curtains in the room, having guided imagery that evokes nature. Certainly things like the Care Channel that have, nature-based imagery. I think those are some other things that are, very accessible. One of your former colleagues at the University of Arizona, I think, wrote this question: any resources or studies about areas of the country where green spaces are more like beige spaces with desert and cacti landscape? Or can that be healing as well?
That's a great question. Actually, there is a greenhouse here at the University of Minnesota before COVID that has 4 different environments. So it has more of a desert arid environment, and so I was talking with Jeannie Larson and an acupuncturist colleague who also does work in this area about creating a study of how people respond to those different environments. A lot of the work with forest bathing is around the benefits from the trees and the healing that takes place there. But there are some studies that talk about outdoors and wherever people feel in touch with nature and grounded. So yes, there are some. I can't quote any off the top of my mind, but a lot of the work is done with tree canopies in Europe and in Spain and in England. And so there is, and we've been having some talks with people, some developers in Oregon about developing nature scores in certain areas. And so it's interesting. It's been on my mind, but I loved Arizona for the time I was there, but it's really hot.
Well, thank you so much for that, Erica. And thank you for participating, all of you, in our integrative nursing webinar today. Terrific presentation, Erica. Lots of comments that I encourage you to check out in the chat. I also want to acknowledge and thank all of our staff at the Bakken Center who helped make today's webinar possible. We hope that you'll join us for our next webinar on October 13th. That'll focus on auricular point acupressure to manage pain, and that will be led by Chao Sing Ye. You'll receive registration information about this webinar in our follow-up email to today's webinar. So thanks for being with us today and have a wonderful rest of the day.